Welcome to another episode of Let's Talk Small Data with T, where we are passionate about the power of small data in healthcare. I am your host, Tanazia Gonzalez, but you can call me T. Data has certainly changed the game in healthcare. Big data has blown the roof off, but small data, now that's the future. Small data allows us to dive deep into the key insights and take quick, customized action to achieve phenomenal results in performance and quality improvement. Let's explore this today. Thanks so much for joining us. If you have any questions for me or any of my guests, feel free to reach out to me at tgonzalez@eima-inc.com. Enjoy the show. Let's go. In Season 4, our topic is healthcare data analytics as a career. I spoke with some folks who are new to the field or thinking about joining in. I also spoke with some seasoned professionals and learned from their insights and suggestions for those who are beginners. I hope you find these conversations as enjoyable and informative as I did. I am so happy to share my discussion with Paulina Palencia-Catalan. She came on the show and spoke to me about her aspirations and her experiences. We had a very insightful and heartful conversation. She's a healthcare data analytics enthusiast, and in this conversation we touched on the crucial role of front desk staff in healthcare, the importance of identifying patterns and improving mental health and services in general, and just really leveraging small data to really identify those patients in need of attention and care so that we can jump in and take actions and improve lives. We also touched on the transformative power of AI and how this could help us really improve and identify those folks that need our attention, and a way to look back and make sure that we're keeping track of people's progress so that we can intervene where needed. Paulina shared her valuable lessons learned over her life and her career. She also shared her thoughts on overcoming imposter syndrome and the importance of mentorship. I am excited to see where Paulina takes her career. I really enjoyed my conversation with her. I'm so inspired by our conversation, and I hope you enjoy this chat. More importantly, I hope you can find something in this conversation that can help you in your journey. All right, Paulina, thank you so much for joining me today to have a chat and just continue our discussion we were having.
Yeah,
Uh,
I'm so excited.
yeah, we had a very intriguing conversation when we first started speaking at the panel discussion at Hofstra recently. And why don't we, before we jump into the conversation, just say a few words about yourself, introduce yourself. Where are you located and where are you working right now? And just a few words.
All right, so my name is Paulina. I am a grad student at Hofstra. I'm pursuing my master's in healthcare administration. I did graduate from Stony Brook. I have my bachelor's in psychology. I'm fairly new to the healthcare space. I have a little bit over a year. I started off working in a private practice, just as the front desk, making appointments, helping patients out. Now I work for Northwell. I'm working from home as
Okay.
a patient account representative. So it's a little bit of a shift starting to work off at home, but I'm getting used to it. Um, and yeah, and right now, I'm exploring the different fields that I'm really interested in the healthcare space. But
Mhm.
so far, from our conversation that we had, and then from what I'm learning in school, I think data analytics is one of my top interests right now, and public health, and
Yeah.
how the that ties into like how we can help the community,
Mhm.
how it impacts everyone around it.
Mhm.
Yeah, that's my little spiel
Definitely.
about myself right now.
But yeah, the psychology thing, that's very interesting.
Yeah.
Love that. And also, you said you started uh, as in the private practices, right? And you were
Right.
in front desk. And
Yes.
I've worked in private practices and over the years, over my career, and that front desk, they are like some of the key people. They're very important because they can give you lots of information about what's truly going on and
Mm,
what truly needs to shift to create a better experience for the patient. Sometimes folks dismiss the front desk staff
Yeah,
as if, it's not a critical role. But in my opinion, it's very critical because they're the ones that can give you the key information and the key to
yeah,
how to turn things around. I mean, they're talking to the clients, they're talking to the physicians, they're talking to operations, and they see everything happening and
right.
can best point out things that are not working well or things that are working well. So
Y-
that's a great experience to have under
Yeah,
your belt,
thank you.
especially if you're considering healthcare informatics, which includes data analytics, because if you understand the full journey from the front is where you have to learn first, like
Yeah.
from the first and that whole pathway
Mhm.
for the client, from the client's perspective as well as the doctor's perspective. And when you're there, right, in the front desk, you're collecting information, right? Insurance,
Yeah,
making sure that folks are eligible, making sure that folks have the key documents and key data elements, right? I'm
right.
pretty sure at that front desk, you were also entering into a registration system or some kind of electronic health record system.
Yep.
Yep.
Yeah, that's funny that you say that because when I
Mhm,
first started off working
mhm.
at that position was when I first started being a student at Hofstra. So
Okay.
then we would do like those icebreakers and we would go out and say what we're doing. I was just like, oh, I'm just front desk. And I remember one of my professors was like, nope, don't, it's not just front desk. And I was
Right.
like, he's like, don't belittle it like that. And I was like, okay, like I get it. And then when I started working in the position, I was like, wow, like I went from making appointments to pre-authorizations to billing to notes, entering everything,
Yeah.
all the patient information, like
Yeah.
you said, eligibility, talking to patients about their process
Uh-huh.
and what their appointment is going to entail and what the services we provide, cleaning
Right.
the instruments, being in the room with the patient. Like it's everything. I
My
could go
goodness.
on
Yeah.
forever about what I did. Yeah.
You're touching everything. And it's like, there's a timeline for the patient, from when they come into the space, so within the service, and to when they leave. And it's like that whole journey, you have to make sure that the data that you're collecting is of high integrity, it's complete, it's accurate, and you actually get it, first of all, to make sure that you're providing best service to the client, making
Yeah.
sure you're able to capture the elements to be able to track the
Mhm.
outcomes of the services you guys are providing and also get paid for it. So
Yeah.
make sure that you have everything documented so that when it gets pushed over to Medicaid or Medicare or insurance, doesn't get denied
Hmm.
for something you missed.
Yeah.
I mean, like your professor said, I agree. I mean, it's taken us a while to really appreciate that role. The front desk is so critical. And it's a great experience to have under your belt as you move forward in your career, in healthcare, especially with data, So when you're entering the registration and data into the EHR, for registration and insurance, you're creating data, creating all these data that really culminate over time to very big data. The
Mhm.
real magic that I'm in love with is when you go behind the scenes and start pulling the data out and creating reports to dive into, let's say, Miss Jones, and
Mhm.
looking at Miss Jones's profile over the last 12 months. Oh, looks like she's not quite retained. Why? The front desk was actually able to capture some issues on her, and that pinged social workers or the doctor to really capture some social determinants of health.
Mhm.
Turns out that she's got transportation issues. She's also suffering from food insecurity. These different things, these data that you guys are creating, starts at the front desk and then it's connected to what's happening behind the scenes and
Right.
then ultimately contributing to improved care.
Yeah.
So you mentioned, you're now expanding and looking at other things to expand your career. What specifically inspired your interest in healthcare informatics and or data analytics?
So it all started when I like took a winter class for data analytics
Okay.
and I was still at that front desk position. And I remember one thing that really stuck with me that my professor said is that the patterns don't lie. There's always going to be a pattern. And with that, I was like, you are right. You were right. Because I remember when I was in that position and I had to see why things were getting denied. And then I would see the different reasons I would have to input why it was getting denied. And when you look back, it's like the same thing over and over again. So I love making those links where like it's from like what I learned in the
Yes.
outside and then when I connect it to my work. So and then even in like and history too, like history repeats itself. So it's just making those two links where it's just like the patterns don't lie and there's always going to be a pattern and then you just have to go back and figure out what that pattern is and how you can improve from there. I mean, making decisions isn't really just heavily being based on the data analytics and what you're seeing. You have to kind of use it as a tool.
It's a guide.
Yeah, guide. So that's what I liked about it.
Okay.
How with mental health services like
Yeah.
that I feel like that's like a common thing that was seeing in my own family
Hmm.
about trying to get help and how it was so difficult to get help and I was like, okay, if it's happening to multiple people,
Hmm.
there has to be a root problem to what is happening. And I just think there's going to be like we're going to find the answer in data in the data. You just have to know how to work the data. I just feel like there's just so much information out there that
Hmm.
it takes time to shift through it and actually pinpoint the root problem. But I feel like the answer is the numbers don't lie. The statistics
Right.
don't lie.
Right.
So, yeah.
That's what I find so exciting, and that's what I find where the power in small data lies. And data analytics, helps with that because it works with big data as well as small data.
Mhm.
So thank you for sharing that information about the mental health services.
Yeah.
Definitely a core need.
Yeah.
So, like when you are able to augment your clinical practice with what data analytics and reporting can do, is real power in that. And it's really exciting. And, building out a career with that in mind, like healthcare informatics, especially with the MPH focus as well, definitely a good direction to go. Very exciting. Uh,
Okay.
really look forward to what you can do with that. And do you have any specific ideas on how you think data, outside of what we talked about already, how data and data analytics could, impact or improve the issues you were seeing personally with obtaining mental health services or services to individuals in need of these services? Anything specific you want to share?
One thing that I think that it could help tremendously is just catching people. Like you said, like the flagging thing is so
Mm,
important because
mhm,
there's so many of us. There's so
mhm.
many of us, and it could it's so easy to get lost in the sea of people. And I
Yes.
feel like that's where many people fall through the cracks and then they just get lost, sadly. And then no one goes back to actually um, see where they're at. And it's just really unfortunate.
Yeah.
Um, but so I feel like with the data analytics, I feel like that could tremendously help with that. And then also I don't know. I just keep going back to the pattern thing where it's just like, I know it's just not me going through this. I'm sure there's
Mhm.
many other people going to go through this as well. But what are the common factors that everyone is going through?
Yeah.
Is it that they just feel like they can't get help? Is the help that they're getting not useful to them?
Mhm.
Because mental health is so diverse and it's different for everybody.
Right.
Everyone has different reaction to things.
Mhm.
Some people take the medication route, some people take therapy, some people do yoga. There's just so many other things.
Right.
And that's all data too. Like even the different preferences that people like,
Yeah.
so important. It's so important to record because one thing may work for someone, but not might work for
Right.
another one. So like everything is just so interlinked, and I feel
Mhm.
like the patterns and the relationships can be easily identified, and then with the data analytics.
Right. Totally. And there are cultural and socioeconomic factors that need to be considered, or reviewed and included in the analysis, because there are certain groups that just have certain beliefs about mental
Right.
health. There's a stigma. The
Exactly.
stigma, unfortunately, is still there. So you're combating that
Mm-hmm.
And, mental health it is like so personal, right? Um, it's it, it's hard to get data on everything you need
Yeah.
because folks are just not willing to share everything. And it's unfortunate. And some of the suicide statistics are crazy. Like the last statistic is that we lose one physician a day to suicide. And it's like,
It's
what?
terrible.
And I saw a documentary once that really dove into this, and it was really about, the doctors. They're wonderful. It takes so much, it's such an investment to become a doctor, and
Mm-hmm.
their hearts are in it, and the issue is when you go to a doctor, most likely you're going to them at a very low point in your life. And often the doctor cannot save you.
Mm-hmm.
And so he takes that home night after night after night after every patient.
Mm-hmm.
How do we help these doctors deal with that, and to help them maintain their mental health? I mean, there are a number of, I mean, the nurses have a statistic as well, and clinical staff. This also expands to firefighters,
Mm-hmm.
cops. They have high suicide rates as well because of the same issue.
Mm-hmm.
Usually they're there at the lowest point of your life, and often they can't save you. They can't be that savior, and it's heavy on the heart.
Mm-hmm.
Um, it's about the flagging. It's
Yeah.
getting to who needs that attention now at the right time. And obviously, you need to have the right data and clean data constantly flowing live and complete to really get some kind of tool or tracker that can give you that list.
Mm-hmm.
Here, focus on these 10 individuals now
Mm-hmm.
and do X. How do you feel about the use of AI in identifying folks who are at risk? What's your feel on? I know this is a little off the agenda, but I'm just curious. What are your ideas around using AI in healthcare to identify folks?
Well, I think it should be used. Honestly, I just think there's so much that there's a limit to what the humans can do or what a
Hmm.
single person can do.
Hmm.
The more help that a person has to identify, the better. So with AI, I feel like if they're obviously one has to go back and recheck if what they're saying, if the AI is saying is true.
Right.
But I think it's just like it's a good security thing
Yeah.
to have that AI to be like, hey, look at this, because it could have been that you could have missed that person or you could have
Right.
missed that group because you were so busy looking at the other data that you have. So
Right.
I
Right.
think it's a perfect, I think it's a great tool, honestly.
Yeah, and some folks feel like there are ethical issues with AI because AI may leave certain groups out of
Hmm.
the denominator because of some quirky thing.
Yeah.
But I mean, I've worked for companies in the past that have AI algorithms
Hmm.
specifically to identify folks who are at risk, at
Yeah.
high risk for suicide and other adverse outcomes. And you're right. I mean, it's great to be able to have, I'd rather have more folks on the list
Yeah.
than fewer than necessary. And it's been helpful. But like you said, you can't solely lean on AI. You got to have a process that really the process is augmented by AI, data analytics. You also have to apply your standard processes to make sure that you're covering as many gaps as possible.
Right.
Yeah, so thank you for indulging me on that tangent, but that's something I always feel really interested in. And I just wanted to hear your thoughts on that because there's a lot, AI is exploding right now. Everyone's in love with AI. And it has its place in healthcare, but because our data is so messy, it's very hard to get clear the best results from
Hmm.
AI algorithms, but in smaller data sets, there may be a real benefit, especially this particular suicide prevention.
Yeah.
Where do you see yourself in, let's say, 5 to 10 years? Where are you going? What are you aiming for, would you say?
So eventually, I just want to feel fulfilled with what I did and what and how did I affect my community and the people around me. There's this quote that I love where I don't know exactly what it said. I don't remember the exact words, but it's people don't remember you, people don't remember what you said, but people remember how you made them feel. And
Maya
that
Angelou.
stuck with me. Yeah.
I
Oh, that
just
is her.
posted that. Just posted that on,
Really?
yes, Maya
My God.
Angelou. Hmm.
So that really stuck with me. And I was like, because that is so true. It's so
Yes.
true. Um, so I just want to be in a position where I know I helped people.
Mhm.
And I want to know that I helped as many people as I could have. And I mean, it's a hard place to be because it's just like you want to help as many people as you can. You can't, like you
Yeah,
said before, you can't save everybody.
right.
But as long as I know that I tried my best and that I made an impact on maybe if I didn't do it directly, but I did it indirectly,
Hmm.
I would be happy with myself. So I don't know where I would be exactly. I don't know what position yet, but I'm still exploring my options, but I
Okay.
just want to know that I want to be like happy with myself.
Yeah, and feel like you've got a purpose here,
Yeah,
right?
exactly.
Um, you don't want to feel like when you get up to go to work, oh, okay, here we
Right.
go again. You want to feel like I'm feeling good.
Yeah.
And this is why I get up every day. And that's what I love about healthcare informatics and data analytics, because I remember one time I wanted to start my career in direct patient care. That
Mhm.
didn't work out. So I decided to stay behind the scenes. And, I've created so many data analytics tools, led teams, and did some great work in HIV AIDS and population health and multiple different um, organizations. And one of my mentors, I said, I just don't feel like I'm making a difference and improving lives. And that's my ultimate goal. Like you said, I'm in this game because I want to be able to improve lives.
Right.
And that helps me feel like I'm fulfilling my purpose. And my mentor said, are you kidding me? If it wasn't for you and your team, we, the clinicians, would not be able to continue providing the support and the services and the clinical care that we give to these individuals. And
Mhm.
my team was the one that could see firsthand, okay, we're seeing these KPIs rising on the charts, meaning the patients are actually getting evidence-based care
Yeah.
and their health is improving. The outcomes are good and where we want them to be. How do we know that? We see it in the data.
Mhm.
And we're able to communicate that and show that to the clinical staff so that they see, okay, we're actually making a positive impact. Pulling labs, pulling
Mhm.
visits, pulling different stats that can give the clinical profiles of the patients, and you could see firsthand the impact. So, like you said, I enjoy being able to make a positive difference in people's lives, even if it is indirectly.
Yeah.
Um, and that's why I started this show, because the podcast, Let's Talk Small Data with T, it's all about leveraging the power of small data, because I've seen it time and time again. It leads to improvement in people's lives. And I have discovered a bunch of people like yourself who have the same interest and passion in wanting to do something different and drive change. And I would encourage you to really continue exploring mental health, that field. And you're in the perfect place working at Northwell. I mean, the opportunity for growth is immense where
Yeah.
you are. I mean, that's a place where you can grow.
Mhm.
And their intranet is chock full of
Yeah.
information on different services. And I mean, what are they up to? About 16 hospitals now uh,
I lost count at
across
this
the board.
point.
Yeah, and they have different other types of services that you could definitely be a part of and really learn about and really identify what are they struggling with,
Mhm.
to what are they struggling with on a day-to-day basis. Specifically, I mean, I know your passion felt so palpable when we were talking about mental health, and I know it was coming from your personal experience and with your family, and I've had similar occurrences with my family, and
Mhm.
that's actually also what drives me. um, to push for change. But definitely use that passion and in your current workspace, really do some research to find out where across Northwell, the mental health services live and what their challenges are. Try to get on a committee or volunteer for a couple of projects, Um, identify a mentor across the space. So many opportunities for you to get involved. That's what I'm saying. Hopefully, your manager would be very supportive of that. I would imagine they are a very forward thinking, and there you go. They invest in their workforce, and they provide lots of training and opportunities for you to get educational support, and they have I think it was called a High Achievers program,
Mm,
where they identify folks who want to be mentored and rise up in the organization in a very methodical, structured way. And that I was just blown away by
mm,
that. So you have ample opportunity. You are in a good place. Um, yeah, and if I, look on my LinkedIn, I'm connected to a ton of Northwell folks. If I can connect you with anyone, please reach out. I'm more than happy to make the connection.
so
Super
much.
excited for you. Yeah, I mean I love that. That's why I do this season of the podcast to really talk to folks who are interested in making a shift or just getting into healthcare data analytics. I'm also talking to some folks that are quite seasoned, been there, done that, and ready to give advice. And we're all super excited to hear the next generation coming up, because folks like you
Yeah.
are our tomorrow. So I'm kind of like our today with one foot in yesterday.
Mm.
I just want to make sure that I'm doing my part and
Yeah.
giving back and mentoring. And it's really exciting to see because I remember when I was there and this is what I would have wanted.
Yeah.
Um,
I'm very grateful for this opportunity. I'm so grateful that I went up to talk to you at that
yeah.
panel that day because I almost didn't. I'm just a super like shy, anxious person, but then like
Yeah.
I've been trying to push myself. That's one thing
Yeah.
that I've been trying to push myself to do
Yeah.
what I usually wouldn't do. So then I pushed myself to go up to speak to you, and then I'm so happy. Like I went to my car that day and I called my sister and I was like, guess what I did? I was like, I would have to talk to her, and then I told her about the whole conversation. But I don't know.
Yeah,
I just
no,
loved it.
I'm so happy you did that. And I too am grateful that you did that, grateful for you and what you're doing and meeting you and now we're connected for life,
Yeah.
and really looking forward to seeing your career blossom and really grateful to Professor Edward
Yes,
uh
to Dr.
for yeah, doctor, right? Uh for inviting me in and just being so engaging. One of my favorite people, by the way. So is there anything else that you feel like you need to be successful in your career and reaching those goals that we talked about earlier?
One thing I guess I would say I would need
Hmm.
is, well, there's two things I guess I would say. Is one thing I need myself to have confidence in myself.
Yeah.
Imposter syndrome is so real.
Oh,
I
yeah.
would look around and my at my peers and compare myself so much and just be like, "Oh, I don't know if I'm in the right spot. Am I behind? Am I not doing enough?
Hmm.
Should I even be here?" But I just want to like keep reminding myself I am worthy. I am supposed to be here. I'm supposed to be where I'm at, and
Hmm.
I will get to my goal. I just have to keep pushing myself.
Right.
I will reach my potential as long as I just keep pushing myself. And yeah, and stay true to myself also as well.
Yes.
And do not get
Yes.
swayed by like stick to myself because that's one thing that I always try to do, and I
Hmm.
even started doing that, especially when I started working with other people, is
Uh-huh.
that I would remember how I was treated before, and then
Yeah.
when I would speak to my patients, I'd always tell myself, talk to them like how you would want to be spoken to.
Yes.
Treat them like you want to be treated. Because remember
Yes.
that
Yes.
time you went to so and so's office and you didn't like the way you were treated? Well,
Yeah.
this patient, you don't know what this patient is going through. You don't know their life story. You don't know if
Exactly.
something happened before they came in, and maybe that's why they're upset. But don't take it personally. treat them,
Exactly.
smile, always smile, and just speak to them like a person. They're a
Mhm.
person at the end. We're all people at the end of the day. So
Totally. Oh my
that's what,
God. Right
yeah.
before you said that, I wrote down some nuggets of wisdom that my mentors have given me. Number
Yeah.
one, don't take things personally.
Yeah.
And it's very hard because we as women sometimes are perfectionists.
Mm-hmm.
I know I had suffered from that and still do once in a while. Just everything's got to be perfect. Cannot make a mistake. Cannot make a mistake. And I had one of my mentors who I love to death would tell me all the time, a shout out to Dr. Victoria Sharp. I'm going to drop her name. She's an incredible person to me and in my career. She has no idea. But she told me one time, she said, T, perfect is the enemy of the good. And
Mm,
that's one quote that I live by and try to remember every day. I always hear her in the back of my head. I'm like, okay, okay, I know. Perfect is the enemy of the good,
mm,
meaning get the word out of your head.
yeah.
Perfect. Number one, don't take things personally. And number three, don't take things so seriously.
Right.
It's not that serious. Okay. Don't take things so seriously. If somebody snaps at you, most likely it has something to do with them, has nothing to do with and always follow your heart. Always listen to your intuition. That's what I've learned over the years. And it's been a bumpy road getting there because as a young woman, it was just like working so hard, like working a lot of hours, burning myself out. Like,
Mm,
why? Is this my purpose? Don't do that. Really get clear on what your focus is, what your intention is,
yeah.
and where your attention is, and always put yourself first. Make sure you don't forget your self-care.
Yeah.
That's
Mm,
really important. Because once you get into these careers, it's like, oh no, I have to make sure I'm doing this perfectly, get to all these meetings on time, make sure I get these reports done, really don't overestimate what you can do. Keep that in mind. I'm talking to myself really because I tend to underestimate the amount of time it takes to do stuff and over promising really it hurts me in the end. So I like to give that advice to everybody, kind of under promise and over perform, and give yourself a break. Compassion, that's another one. Make sure you have self-compassion, forgive yourself. That's a hard one for folks,
yeah.
just starting out or being here. Some people really struggle with that. But like if you're really leaning into perfectionism and you're not being compassionate with yourself and you're being too hard, you're taking things too seriously, these kinds of things lead to adverse mental health outcomes for you. So I don't know, just keep a pulse on. And I love how you started off with the I am confident, I am this and that. Sounds like you're a big affirmation person, um,
Yes.
which I have really gravitated towards the last 10 years. And it's been incredibly helpful. And it's really a great resource, like doing those positive affirmations. It just helps keep your mindset positive and in the right direction. Because
Right.
if you have a certain goal, also goal planning for yourself. It's in the right mindset. And I love the things that you said in terms of what you're doing to help keep yourself centered. So keep doing that. That is very inspiring,
Mm,
motivating. And I know it will help a lot of folks. So
yeah.
thank you for
No,
sharing.
thank you for the advice because of the perfectionist thing. I'm the first generation. I'm the first one who graduated from college in my
Right.
family. So,
Beautiful.
and I'm the oldest. So I feel like all the time I need to be perfect for my younger siblings and for my parents. I just need to set the perfect example. And
Right.
I just need
Right.
to do everything well and I can't mess up. And I gotta, like,
No
it's,
pressure.
I know, no pressure.
Okay. It's
But
like,
yeah, but I just
yeah,
gotta remember I'm a person too.
yeah.
So there's only so
Remember to deep breath,
yeah.
be kind to yourself. Yeah, be
Yeah.
kind to yourself. And I'm sure your siblings are so grateful that you are willing to take on that role and be serious about it and really develop it. And you'll be there as a mentor for them. And
Yeah.
no, it's wonderful. I think mentorship is definitely um, a key part of, career, professional development, professional and personally.
Yeah.
People love sharing their stories because it's not just, hey, I'm in this position and I'm VP. There's a whole story behind that.
Yeah.
There's a whole family
Mhm.
behind that person and things that they had to do in order to be where they are safely and successfully. So, thank you so much for spending this time. I am so happy that I got an opportunity to talk with you on the show. I'm really looking forward to publishing this, putting it out there. And before I do that, some people may want to get in touch with you. Is
Mhm.
that okay? And if yes, what's the best way to reach out to you?
Yes, of course you can anyone can reach out to me. I'm happy to talk about anything. Um, I guess the best way to reach out to me would be through email or my
Okay.
LinkedIn, but
And I
yeah,
will be sure to put that in the notes of the show
yeah, okay.
so folks can just capture that,
Yeah.
yeah, should they want to reach out.
Yeah.
Okay, so we're coming to the end, and is there any last words you'd like to say before we end?
That I'm so grateful for this opportunity. I just can't get it through my head that like such a seasoned player like you wanted to take the time to speak to me. I just came into this
Of
like
course. Yeah.
I'm so grateful. Like you have no I can't even put it into words. I'm just gonna word vomit how grateful I am. But
Thank you.
yeah, and then for
Ditto, ditto.
those who feel like
Mhm.
that they're not in the right position or like that they're not doing enough, you are doing enough. Just remember
Yes,
that. And that there's a whole community of people out there who wants to speak to you about your goals, like now, like what I'm doing right now.
yes, yeah,
'Cause,
totally.
yeah, 'cause I used to be the person that would never talk to anybody, would just try to figure out everything by myself, but no, you gotta reach out to other people, and there's
Right.
other people who are willing to help. It's not
Other
scary.
people willing and looking to help, looking for people to help. And there are a whole host, like you said, a whole community of people that just love helping and mentoring and definitely take risks,
Yeah,
calculated risks.
yeah.
Not, not
Evidence-based risks. Yeah.
haphazard, it's important to take risks in life.
Right,
Exactly. Because if you don't, opportunities will just pass you by.
right.
And I'm a big believer in the universe. I'm one of those divine intervention. The universe will present to you the
Mhm.
opportunities that are right and meant for you at the right time. So if you're busy going, oh no, I can't do that. Oh no, I'm too scared, then you're missing out.
Yeah,
And you need to put that to the side and just
just do
go
it.
for it.
Yeah, 'cause what if I just went into
So
the car after
totally,
the event? I wouldn't be here.
totally. Yeah,
Yeah,
you are a living example of that.
yeah.
And I thank you so much for coming on the show. And I'm grateful for you. And
No.
thank you so much. And have a
Yeah,
great one.
thank you.
Thank you.